Blessings everyone, welcome back to the People's Tribune. Today, we're diving into an issue that touches every family, every community, yet remains swept under the rug: mental health. Too many of our brothers and sisters are suffering in silence. Depression, anxiety, stress, trauma, these are not foreign words anymore. They are real experiences happening in our homes, our schools, our workplaces. And yet, when we look around for support, for services, for leadership, what do we see? Almost nothing. We like to talk about building highways, hotels, and big projects. But what about building people? What about the young man who can't cope after losing his job? What about the mother struggling to raise her children with no support system? What about our students who are carrying the weight of violence, poverty, and pressure, with no proper counseling in schools? Government after government has promised reforms, but mental health is still treated like an afterthought. Our hospitals are under-equipped, our communities lack trained counselors, and the stigma remains heavy because no national campaign has been pushed consistently. Meanwhile, suicide rates quietly climb. Families quietly break apart, and the silence continues. Leaders, we are calling on you. Mental health must be treated as public health. Put resources in place. Train more professionals. Bring counseling to schools and communities. Launch awareness campaigns that remove shame and replace it with understanding. And to the people, we cannot wait forever. Let's check on each other, let's create safe spaces in our communities, and let's demand better from those we put in power. Because a nation's strength isn't measured only in GDP or skyscrapers. It's measured in the well-being of its people. Key statistics and trends. 1. Prevalence of depression. In 2016, about 14.3% of Jamaicans, roughly 1 in every 7 people, were estimated to suffer from depression. Among people with chronic illnesses, diabetes, hypertension, asthma, cancers, etc., depression rates are even higher, ranging between 20–30% depending on the condition. 2. Suicide rates and trends. Jamaica's overall suicide rate is about 2.1 per 100,000 people. Recently, suicide cases are on the rise. In 2024, there were 67 suicide deaths, the highest since 2001. The numbers have climbed from approximately 43 in 2020 right pointing arrow approximately 50 in 2021 right pointing arrow approximately 64 to 66 in 2022 minus 2023 right pointing arrow 67 in 2024. Gender disparity is sharp. Men account for the vast majority of suicide deaths. For example, in 2024, 61 of the 67 suicides were men. 3. Youth mental health and suicidal ideation. Among Jamaican adolescents ages 13 to 17, approximately 25% had seriously considered suicide and 18% had attempted suicide in the previous 12 months, as per a 2017 school-based survey. Also, via the U-Report digital tool, youth aged 13 to 29, many have reported considering suicide. 4. Mental health service utilization. In 2015, over 108,000 visits were made by persons with mental illness to public health facilities. Of those, the majority were for serious conditions like schizophrenia, psychosis. 5. Resource infrastructure shortfall. Very few psychiatrists relative to population. For example, Jamaica has about 40 psychiatrists serving over 2.8 million people as of 2023. That's approximately 1 psychiatrist per approximately 70,000 people. Prisons, correctional facilities are especially under-resourced. Mentally ill inmates are housed in inadequate facilities, sometimes treated in inappropriate conditions, e.g. medical services done on benches, rotating rooms, and there is no dedicated forensic psychiatric facility. 6. Government interventions and public response. Helplines and outreach. The 888 New Life Mental Health and Suicide Prevention Helpline has seen increased usage over recent years. Programs like Problem Management Plus PM Plus have been launched in communities, training local persons, churches, community-based organizations in counseling, psychosocial support. Anti-stigma campaigns, #DoYourShare, school mental health literacy, wellness centers for children, adolescents are also part of the current strategy. Gaps and challenges. Stigma remains strong. Many Jamaicans still view mental illness as taboo. This discourages help-seeking and honest conversations. Inequalities in access. People in rural or poorer parishes often have much less access to mental health services. Also, high costs in the private sector put care out of reach for many. Shortage of specialists and other trained mental health workers, especially in less urbanized areas. Infrastructure issues in institutions, prisons, hospitals make proper care difficult. Aftercare follow-up are often weak. Once released or stabilized, many patients are not well tracked, or don't have community support structures to maintain mental wellness. Why it matters. Rising suicides and mental illness aren't just personal tragedies, there are broader social and economic costs. For example, loss of productivity, increased health care burden, strain on families' community resources. Early mental health issues, especially among youth, can lead to worse outcomes later: substance abuse, violence, chronic conditions if not addressed. Mental health is intertwined with other national challenges: economic instability, violence, crime, social isolation, effects of COVID-19, trauma from disasters.
Jamaica, our strength is not in highways or hotels, but in healthy minds and strong families. Government, enough talk, it's time for action. And people, let's check on each other, break the silence, and demand better. Mental health is national wealth. Let's rise together.